Well, good afternoon and welcome to our entire audience joining us for another American Consumer Institute webinar. My name is Krisztina Pusok and I'm the Director for Policy and Research at the Institute. Today we'll look at the role of scientific evidence and misinformation in the current vaping and e-cigarette policies. I'm very excited for a fabulous speaker and expert on this issue who is joining us today, Michelle Minton. Before I go ahead and introduce Michelle, I do want to say that everyone is in the audience is in listen-only mode. And just a reminder for those of you joining us for the first time, the American Consumer Institute is a nonprofit educational and research institute committed to be a reasoned voice for consumers by improving the understanding and impact of public policies. If you'd like to learn more about the work we do, please go visit our website at theamericanconsumer.org and subscribe to our newsletter. So I'm very delighted to be joined today by Michelle, who's a senior fellow at the Competitive Enterprise Institute, where she specializes in consumer policy, covering regulatory issues that include gambling, tobacco harm reduction, cannabis legalization, alcohol, and nutrition. Michelle has authored numerous studies and her analysis have been published and cited by the New York Times, the Wall Street Journal, and USA Today, as well as peer-reviewed journals. She regularly appears in news media to discuss the unintended effects of laws and rules designed to save adults from their own choices, which not only conflicts the principle of individual liberty, but often the goals of public health. So I'm very delighted to have Michelle with us today because this topic that we're covering today is particularly salient given the extraordinary times we're facing. And over the last year, there has been a lot of misinformation and disinformation spreading around. And we even witnessed extensive efforts from activists, lawmakers, and regulators to restrict and even ban vaping and e-cigarette products. And often cited is either the lack of evidence on the effects of these products, but sometimes also the potential harmful effect. So Michelle, I do want to ask you, what does the scientific body behind this research say about the health impacts of e-cigarettes and vaping products? What are the risks? And do we have data on what the short and long-term effects are of these products?
Yeah, I mean, one of the most common arguments you'll hear when someone is advocating for a restriction or a ban on various nicotine vapor products is that we just don't have enough evidence. And this is one of the most ludicrous arguments because there are thousands and thousands of studies at this point on nicotine, on vapor products specifically, and we know a lot. I mean, there are no 20-year clinical studies of e-cigarettes because they haven't been around that long, but that's also not really necessary. You can tell that smoking is damaging to the lungs and the heart and life-threatening within a couple of months of use just based on certain markers. And the evidence that we have from the use of nicotine vapor products indicates significant benefits for smokers who switch to these products and few or no real serious risks, even for people who are not current smokers who use nicotine vapor products. I mean, there's an initial impact on the cardiovascular system in terms similar to caffeine, where it's a stimulant. So, your vessels constrict temporarily, and then it's actually a lot like jogging as well. That happens when you jog, your vessels constrict, and then they go back to normal after a little while. And jogging and caffeine are good for you, depending on who you ask. Most people say jogging for sure. So what we know is that absolutely positively, smokers who switch to e-cigarettes or even replace some of their smoking with e-cigarettes are doing themselves a favor. And the risks to non-smokers are unclear and likely minimal. It's similar to what we know about cannabis, for example. I know we were talking about this before the webinar started, that there's a lot of information about marijuana and cannabis use, but there isn't certainty, there isn't proof about all of the effects. But what we know is that it's unlikely to cause massive, significant health problems in most people.
Mm-hmm. And there's a lot of debate with regards to the flavors. So are the flavors necessary for vaping to successfully help adults quit smoking?
Yeah, I mean, in the beginning, a lot of vapor, thousands, if not more, vapors were saying flavors are absolutely essential, and they were dismissed as anecdotes. And then since then, there have been a lot of studies about the effectiveness. There was just one that came out earlier this month from Yale showing that flavors weren't the use of flavors in adolescence, flavored nicotine vapor products, wasn't associated with later initiation of smoking. However, the use of non-tobacco flavored vapes for adults doubled the chances that they were going to be an ex-smoker in the future. That's huge, and that's something that people who use these products, adults who use them, have been saying forever, because what you're doing, nobody likes tobacco the first time you use it. It's not a particularly pleasant flavor. It's just that your brain associates the pleasant feelings of nicotine with the flavor of tobacco, and when you start using other flavors, it breaks that association. You start to associate the pleasant feelings with a slew of flavors. And in fact, some studies have shown that just the number of flavors a person uses is associated with their likelihood of succeeding in quitting smoking, because you're not associating it with one particular thing or the other. And people being forced to go back to tobacco flavor they're being set up to fail almost, because now they've reacquired a taste for tobacco, and it would make it easier. People who switch to e-cigarettes and then lapse, which frequently happens, especially in the beginning, said that it was gross. It actually reinforced their decision to quit using vapor products. But if they get reacclimated to the flavor of tobacco, it will make that barrier much lower for them to continue smoking or return to smoking.
Mm-hmm. And how has the vaping and tobacco harm reduction debate been playing out in the US over the last few months? So can you explain a bit why the concept of harm reduction is an often disputed and contested concept?
Harm reduction is ubiquitous in public health conversations and policy conversations. The funny thing is that it is usually Republicans or conservatives, people who are very religious, who make the moral hazard argument. This is the idea that if you make something less risky, people will do it more. For example, seatbelts. If we require everyone to wear seatbelts, the fear was people would drive more recklessly. And while accidents did increase, death rates dropped significantly. So that's the reduction of harm, where maybe people are getting into accidents, maybe even they're getting into more accidents, but they're not dying from them. They're being injured at lower rates. We've seen it with opioid use. With heroin, for example, we'll have clean needle exchanges because people recognize that you're not going to be able to stop everybody. You're not going to be able to convince every teenager from never trying these drugs. Some will get addicted, and maybe the best we can do is to get them into a space where they're not having transmission of STIs, where they can maybe get other types of treatment and have access to medical care. So with the tobacco harm reduction, and the reticence or the rejection of tobacco harm reduction has been going on in Europe for a very long time, with snus, a smokeless tobacco product, a chew, that has radically lower risks compared to smoking, and it's popular only in Sweden because Sweden and Norway, but it's only legal in Sweden, whereas it's banned in the rest of the European Union. The pushback on, I think, besides the moral hazard argument, one of the big pushbacks against tobacco harm reduction is the idea that if you continue to allow e-cigarettes to be used by adults, if kids use them, if more adults use them, what is happening is you have a bigger user base that's going to push back against attempts to restrict them. So what I'm seeing in tobacco control, the people who are anti-nicotine vapor products or anti-snoozes, they are trying to tamp down on the global user base as much as they possibly can while they get control over this new product.
Mm-hmm. So we had a series of news stories circulating about several vaping lung injuries over the last year. So what are the facts behind that? What do we know about which products actually cause people to get sick and even die?
Yeah, beginning last summer, last June, there were a cluster of cases in Wisconsin of youth going to the hospital with severe lung injuries. The one common thing they all had reported to physicians was vaping. They had vaped, and right from the beginning, I know a lot of us in this space were, asking, what were they vaping? And this is a problem, a long-standing problem in the research area, is that we ask on surveys and have been asking since at least 2011, 2012, have you vaped? Have you used an e-cigarette? And we use these terms interchangeably, even though we know that people don't just vape nicotine. Sometimes they don't vape nicotine, it's just flavors. Sometimes they vape cannabis products with vaping devices. And rapidly, as the stories began to emerge, as local newspapers started to ask the individuals who were involved about what they were doing, it became very clear that most of these patients had admitted to using THC products. And I wrote something in July and August about this, saying it's becoming very clear that this might be involved. And then it became indisputably clear by the fall that it was not only THC products, but it was tainted THC products purchased on the illicit markets, the black market through dealers. Most of these kids, shockingly, we got up to 70–80% of the people involved admitting that they had used illegal cannabis products in a state where it already wasn't legal or they were underage. You never see in any kind of outbreak, you very rarely get to numbers that high with someone saying, yes, I ate this, or yes, I was here. Usually it's much lower, but we can still say it seems very likely this is the cause. Yet CDC continued to say e-cigarettes and vaping, and we should avoid all vaping, even though, and they said that through November, they started to temper it a little then, but it wasn't until January really that they dropped the recommendation to avoid all vaping, which created massive misinformation. The public, for the most part, still isn't aware that that outbreak of lung injuries was caused by THC vapor products bought on the illicit market, not any kind of regulated marijuana product or e-cigarettes.
And just to follow up on that, so you mentioned the CDC, and so it seemed like the narrative still remained over there that e-cigarette had to do something with those injuries. So why is this messaging particularly damaging for consumers?
Well, I mean, obviously there's the immediate, I had some friends saying they were texting their kids in college, because kids in college are very likely to use or experiment with cannabis products, saying, do you know this? And they would say they had no idea. They thought it was nicotine vapor products. So the risk is very immediate that people they don't have the choice to avoid products that might kill them, honestly, put them in the hospital, cause permanent lung damage, or kill them. And the CDC should be held culpable for failing to give the public this easily identifiable, and marijuana news outlets did a very good job at warning their customers, which, you hope people who are using these products are reading those outlets, saying, this is what's happening. Do not buy these products. Don't buy THC cards off the black market. This is what is happening. But the CDC continued to obfuscate, to bury that very important information, which puts lives at risk. The other really important problem that it creates when respected health organizations do this sort of thing is it hurts their reputation. And the fact that this outbreak and this miscommunication by CDC was immediately followed by the COVID pandemic, by a real serious pandemic, when people were looking to CDC and wanted to trust them. I mean, I know even just within people who are vapers, people who are in this space policy-wise, were very skeptical of what the CDC was telling them right from the start about COVID, because they lost trust in that institution. And that's really important when it comes to emergency situations.
And I want to focus a little bit on the role of these institutions, because we're living through some very unprecedented times, and many of us are looking for answers. So what did the Trump administration, particularly in the FDA, you did mention the CDC, but what did they decide to do about the regulation of these products?
Right, so this is last year, or 2019, no one's really exactly sure where it started. Some believe Melania whispered in Trump's ear and said, this is a problem, we need to do something. And then Trump talked to HHS, Health and Human Services Secretary Alex Azar, and publicly said that he was going to direct the FDA to ban all non-tobacco flavored vaping products. And that, instantly galvanized vapors, shop owners, vapors, policy people, consumer rights people, to protest this, because it seemed like the president was given bad information, that the solution was far too extreme for the problem and wouldn't even solve the problem and would likely create new problems. So, through speaking with the administration, he sort of backpedaled a little, and what ultimately happened was that FDA prohibited, they took off unapproved flavored vapes that are in cartridges, so the pod-based systems that you replace a pod on a battery. All flavors except for tobacco were banned for those products, but for open tank systems that you would buy at a vape shop, for example, with liquid, you can still have flavors in those products, and also with disposables. And now you have people in the anti-tobacco movement saying that's a huge loophole we need to close.
Mhm. So we've also seen several states, right, including New York, that actually have used the pandemic to justify banning flavored products. But uh, on the other side, there's no research supporting the claims that being used to try to ban these e-cigarettes. So what is the threat of restricting or even banning these kind of products?
So I mean, during COVID, and in one way, it was a logical assumption that if you smoke, you are more susceptible to certain types of upper respiratory infections. We already know this. This is true. There's very little data on whether that's true with vaping, and at the time in the beginning there was zero information about how these two types of behaviors would affect your risk of COVID. And then the evidence did start to emerge, perplexing evidence that among hospitalized COVID patients or people who are testing positive, there's a shockingly low number of smokers. And if you're a scientist, that's the first part of the scientific process, is you notice something weird and then you go research it. And as people investigated, it did seem all over the world to be a trend. Why that is, we're still investigating. But as you said, there's no real information about the risk of vaping. What we can say is that if you are a smoker and you can't quit, using something like a vaping product, a nicotine replacement therapy, or snus very likely will reduce your health risks in an environment like this. Not necessarily stopping nicotine use, because that might actually have some benefits that we don't know yet.
Mm-hmm.
I don't think I answered your full question.
Well, we'll get back to that in a second. So, but I do want to talk a bit about the uptake in vaping and e-cigarette use in children and young adults. And because, I mean, to address this, there has been a push to raise the smoking and vaping age to 21. But I do know that last month you released a report on the connection between underage e-cigarette use and anti-vaping advocacy, which found that vaping did not escalate despite the increased anti-vaping messaging, but because of it. So why are these findings important?
So the United States has raised the national age limit for tobacco products, which does include vapor products, to 21. And it's very funny how the evidence for whether or not vaping should be legal or flavors should be legal, the barrier for proof is sky high. Yet when it comes to passing policies like Tobacco 21, the evidence, there were very few studies on what this would do. And a lot of the studies indicated that by raising the tobacco age limit to 21, and if you include vapor products in that, smoking goes up among people under the age of 21. And I was saying this before they instituted the policy, saying maybe you should put in a study before you do this, or at least study it afterwards, and nobody really listened. And so what we have happening now with the youth smoking or the youth vaping epidemic, it isn't an epidemic. Most youth, and this is Harvard School of Public Health has said this, most youths do not vape. They don't. There is a small number, it's much higher now, in the 20s of percent, maybe 27% in the last month say they have used a vapor, or they have vaped, so we don't know exactly what they're vaping. They have vaped at least once in the last month. That doesn't mean that they are a habitual nicotine user. It could mean that they are taking a hit off a friend's Juul or a friend's THC vape at a party once in the last month. And if you actually look at the numbers, the number of youth who never smoke, don't use tobacco, who are vaping habitually, and again, we don't know what they're vaping, but who vape habitually is under 1%. It's a very small number, but the news has constantly repeated this idea that there's epidemic, which was a talking point created by the FDA at least in 2018, if not earlier. And the minute that Scott Gottlieb, the former commissioner of the FDA, came out and said it was an epidemic, they already had a media campaign ready to go around that message. And it has been repeated over and over and over again. And, we've seen, thousands of news stories about it, thousands of local news stories with parents going crazy and teachers saying it's a problem, and, not a whole lot of evidence that it actually is a problem, but a lot of people saying it is. And the paper that you mentioned that I wrote, I wanted to investigate why in the US we had, vaping increased as it was a new product. So as it became more popular, it was increasing in use among youth. And then it dipped after 2015, and for 2 years in a row, it dropped by 30%, which was enormous. And then all of a sudden, back in 2018 again, it skyrocketed right back up. And I was wondering what happened then, because this was at a time when Juul had been on the market for a while and popular for a while. They had pulled back on most of their flavors. A lot of companies were pulling back on flavors. They were all eliminating their social media presence, and there was a lot of attention from lawmakers and restrictions being discussed, if not actually implemented, on these products. So the fact that youth were increasingly experimenting with nicotine vapor was perplexing, and I said, I want to investigate that. And when you dive into the psychology of health communication and youth developmental psychology, what you see is the constant pitfall of telling teenagers not to do something is the best way to convince them to do that exact thing. And that's why the title of the paper is Perverse Psychology. This is not, ads saying don't litter, or if they show people littering, the very famous one is Iron Eyes Cody, the Native American crying on the side of the road while people throw trash. Researchers now think that probably had no effect on people's littering behavior, or if not, maybe encourage them to litter more because they were identifying with people throwing the trash, not the Native American man on the side of the road. And if you look at the anti-vaping ads that are aimed at youth, so their goal is to get as many young eyes to see these ads. What they feature a lot of the times are youth actively vaping. They show them vape, they talk about flavors, they talk about where they got them, how they hide them, how great they are, how all their cool friends do it. And if you don't vape, you're looked at as an outsider. These are all messages that, if you think about it, are functionally designed to convince youth that they should try these products. And in the last national survey on tobacco use, we finally got a question. I got a question put to teenagers saying, well, why, if you vaped, why? Why did you do it? And the number one answer by far was curiosity. And so, the conclusion of my paper is that if anything stimulated the curiosity of youth to try these products, it was adults, especially from the media, honestly, because teens tend not to trust authority figures. The media doesn't count. So the media saying that there's an epidemic was functionally translated into teenage brains as, all of my friends are doing it, maybe I should give it a try too, so I'm not a weirdo outsider, so at least I can say I've done it. And that should be informing how we move forward, how we direct policy and health communications on e-cigarettes to make sure that we're not just making the problem worse. If you look at the United Kingdom, for example, less than 5% of youth are classified as current e-cigarette users, and over 7% of adults in the UK are e-cigarette users. And I think part of the reason that they have no epidemic of youth vaping in the UK and a significant portion of adults using it is because they have targeted their messaging at adults. Teenagers see these messages and they think, that's an old person thing, that's for old smokers, it's not a cool, rebellious youth behavior. And you see that in other countries as well.
Mm-hmm. So if we focus specifically on the long-term consequences of making the safer products less available to people while also perpetuating false information about this risk, what are those consequences?
Yeah, I mean, the consequences are...
What would be the worst case scenario?
The worst case scenario is that smoking rates go back up. And when I was just looking at Canada's health statistics, they categorize them by age group, and there was one age group where in 2017, the smoking rate went back up, which is always very disturbing for anybody who cares about public health at all. That should not be happening at a time when everybody on the planet, pretty much, if you have access to a television or a computer, knows the risks of smoking. So to see the rates go back up is very disturbing. The funny thing is that was also the only time in that age group that vaping went down. So you have this, and in Sweden, you still have about 20% of the population, 15 to 20%, using nicotine. It's just that most of them use snus, and they have the lowest rates of lung cancer in Europe. So what happens, you can't stop people from drinking alcohol or using nicotine or using recreational drugs. All you can do really is kind of try and make sure that they have the information about the relative risks of all of these different products and access to the safest form of that product, safest way to do it or use it or consume it that they possibly can. That's why we have, clean needle exchanges or safe injection sites. That's why, if you raise taxes on alcohol, for example, people usually just drop down to a lower quality of alcohol or a higher proof of alcohol, which can be problematic in its own way. So when you restrict anything we do policy-wise with nicotine vapor products that makes them more expensive, harder to get, so that could be restricting them to certain outlets or disallowing online sales, for example, more expensive, harder to get, and less appealing. So by eliminating flavors, for example, all of that means that people are far more likely to either just continue smoking or go back to smoking. Mm-hmm. And that's a huge risk.
And you alluded to this a bit, but what is the economic impact of vaping in the United States, and should e-cigarettes be taxed like traditional tobacco products?
Yeah, I mean, I don't. So e-cigarettes or the nicotine vapor market is a significant economic sector, and I think most of us would argue that that's important, but shouldn't be as important as the health concerns, the ability for people to freely choose a safer alternative to smoking. But it is, we're talking about 100 over 100,000, maybe 160,000 jobs supported by the nicotine vapor industry. Talking about maybe about 10 billion in direct sales for nicotine vapor products. And to put that in perspective, 10 billion, that's actually more than the sales of all yogurt and yogurt drinks in the United States. So that is not an insignificant product in American life. And a lot of direct jobs are supported, but also ancillary jobs related to the industry. And most of these shops, I think over 13,000, maybe closer to 14,000, are independent. This is not big tobacco, not Juul. These are just independent vape retail shops. So it is huge, and flavors are a big part of that because they make up about over 85% of their sales. So if you eliminate flavors for these products, you functionally eliminate that market. You eliminate the products because most of these retail shops will not be able to sustain their model on 15% of the sales they were making before. It's just not worth it for them. So they'll close, and then all you'll be left with are the Juuls and the Icoses and whatever else big tobacco decides to put through the regulatory process.
Mm-hmm. So we're getting towards the end of the webinar, but I want to get back to a few points you mentioned before. And I think it's fair to say that we have allowed our concerns about speculative harms to overshadow the known benefits to adult smokers. So how should e-cigarettes and vaping products be regulated so that consumers are not at risk from potential harmful effects, but they can also access the benefits of these products?
Right, so the outbreak of lung injuries we talked about related to THC products, that was because that was fueled by the fact that cannabis is not legal. And even where it's legal, like in California, it is so highly taxed that it's too expensive for most people to purchase. So they turn instead, like I said, you can't stop people from doing things, but you can certainly push them towards more dangerous avenues. People who couldn't afford it or couldn't legally access it because of their age or the state they live in, they turn to the black market, the illicit market, and there are dangers lie there because those people, the people who operate, they might be good actors, but they're not accountable necessarily. You don't know what you're getting when you purchase it from a dealer on the street or your friend, from school. The best thing that we can do for people if we want to prevent the harms that might be associated with any kind of substance use, while still giving adults the benefit, would be to make sure that anything that they want, any of the product categories or flavors that they want, are available legally on the market so that the FDA can know what's in them. And then if something happens, the FDA can track them and can penalize them if they adulterate their product. And then they can also work with states to make sure, because before the THC lung injury outbreak, a lot of states didn't have vitamin E acetate on their list of prohibited ingredients. Now they all do. So, that's the FDA can work with the states to say, there might be, the research is indicating there might be a problem with this ingredient, so you're going to want to take it out. And, e-cigarette makers, liquid makers, the flavor makers, they will sell their products on that. They will sell their products on being safer. And I remember in the earlier days, you would see, this is free of X, Y, and Z ingredient. And even if there wasn't a lot of evidence that it was problematic, they knew their customers were worried about it. So, the best thing we can do is regulate it. I'm not going to say tax it, but that's how you fund a lot of this policy stuff. And if you're going to tax it, it has to be taxed similar to nicotine replacement therapies. And if we're talking about the anti-tobacco people, they're advocating that Medicare and Medicaid cover nicotine, that people don't have to pay for nicotine replacement therapies at all. So I think if you're gonna tax anything that's low risk, like snus or IQOS or e-cigarettes, the tax rate has to be linked to the relative harms, because e-cigarettes, nicotine vapor products, are one of the few things in public health where you really don't have to do anything, and you, as a society, reap an enormous benefit, both in the health of the citizens and money, because smoking, the diseases from smoking cost our healthcare economy a huge amount. Lung cancer in particular is one of the most expensive forms of cancer in healthcare. And so, you just get out of people's way and they will give your society an enormous benefit.
Mm-hmm. And with that, we conclude our webinar today. So thank you, Michelle, for sharing your valuable time with us today. And I'd like to also thank the audience for tuning in. Thank you all and have a terrific day.